We're now going to continue our discussion about the importance of healthy, nutritious diets and how we increase access for some of the country's youngest eaters. So please join me in welcoming to the stage our moderator, Rose Scott. I'm so honored she's here. I can't even tell you. An award-winning journalist and the host of A Closer Look on Atlanta's NPR. Thank you.
Hello, can y'all hear me? I have this really cool Beyonce microphone. It's like, break out and start singing. Wow, thank you all for being here. I guess I get the honor of also introducing our next panel, so I'm going to go ahead and get right to it. I think it's interesting that they give a journalist only 25 minutes to talk about, now you're telling me to move. See what happens? I follow instructions very well. They only give us 25 minutes to try to figure this out, but we will do the best we can. So let's welcome Kelliann Blazek from the Special Assistant to the President for Agriculture and Rural Policy, Alastair Pullen, Executive Director of the Atlanta Neighborhood Charter School, Will Sellers, Executive Director, Wholesome Wave, Georgia. I think he's been on my show. Diane Harris, Senior Health Scientist and Team Leader for the Centers for Disease Control, and Lysa Ratliff, CEO of KABOOM. Your panelists. Y'all can clap. I hope y'all get a little bit more enthusiastic about that. That's okay. Actually, I want to start with Alastair. Can you give us a snapshot of the average student at the neighborhood charter school? Who are these students?
Absolutely. Well,
yeah.
First off, thank you for having me. Thank you to Food Tank for having us here as part of this panel, and I look forward to the conversation ahead. So for those of you who are not familiar with Atlanta Neighborhood Charter School, we are a charter school in Metro Atlanta. We have 2 campuses where we serve students from grades K through 8, about 630 students, and 133 employees. Central to our work as a charter school is to innovate, is to think about education differently. And one of the ways that we do that is thinking about the importance of nutrition and local food. We have 2 working farms where we produce over 2,000 pounds worth of food that then goes into our nutrition programs, which serves our students for lunch. And when it comes to characterizing the typical student at ANCS, the first word that comes to mind is joy. And that is when you come and you see our students, they are excited to be in school, they're excited to be there, and that is in huge part the result of the holistic approach that we take. They have energy, they're eating nutritiously, they're excited, they're engaged, and they understand what it means to be part of a neighborhood and a larger community as well.
And so I want to stay with you for a moment because I'm curious, for those students who attend your school, what would you say is their level or their knowledge of understanding where their food comes from, as opposed to then once they've been in your school for a few months? The knowledge, I'm sure, is shifted.
It shifts greatly, and part of their educational experience involves working on our school farms so they see firsthand where their food comes from, and it's always really fascinating to see students' knowledge improve and increase as they matriculate and get older during their time at ANCS. I think very specifically of our kindergartners who come in and they're kind of wandering around the farm and what is all this, and used to oftentimes more processed foods. Mm-hmm. And to see those light bulb moments and that information click where all of a sudden they realize that, wow, the lettuce that was on our farm is now in my school lunch, and actually I worked to pick that, is a really, really neat moment when we see all of these things that should be common sense become integrated, and it makes sense in the mind of a 5-year-old, and then, of course, again, in the mind of a 12 and 13-year-old.
Kelliann, when you hear this story from Alastair, not all students in this country, K through 12, particularly in our public education system, get to experience that.
Swap mics here. First, I want to start with an audience question. How many people ate school meals at their school? Ate school meals. So for those at home, there's a bunch of hands up. There's 30 million kids that eat school meals every day, and so it's a big chunk of the population, and it's a big lever that we have at the federal government. So I just wanted to highlight one action that we're taking. It's in Pillar 3 of the National Strategy, which is proposed rule that USDA issued last year to advance stronger nutrition standards in hopes that more schools will offer healthy foods, like Alastair mentioned. One of the key pieces of that is what would be the first ever added sugar limit in school meals. We know kids are eating too much added sugar. I get a thumbs up right there. I appreciate that. And so wanted to highlight that because in previous iterations and previous administrations that have tried to advance higher nutrition standards, it's been rolled back by Congress. So USDA will be finalizing the rule this spring, and we're really excited to get that out, but we really need folks and the public to support that rule and hopefully support more schools being able to do what schools like Alastair are doing and ensuring healthy foods for kids.
Diane, I want to come to you because we've heard so far, and I love this word because people come on my show all the time and they say it takes a holistic approach to this, that, and the third, and we keep hearing about a holistic approach, but when it comes down to folks understanding the importance of nutritious, healthy lunches, breakfast for our students, it seems it's still missing. There's this perception of, well, you know, some districts can do this and some districts can't do that. So there's always this red tape where someone says, oh, it's complex. But it shouldn't be that complex. How do we get beyond that and just do what we need to do to make sure those 30 million students that she talked about, every student has access to nutritious, healthy breakfast and lunch at school, and maybe even after school?
Sorry, that was for me?
Yeah, you get all that.
Yeah, so thank you. At CDC, we're working with a number of different agencies, and we're a part of that White House strategy in developing those different approaches. So we work really with states and communities in lots of different food access strategies, everything from the fruit and vegetable programs, the nutrition incentive and the fruit and vegetable prescription programs that Will's going to talk about in a minute. We work with access to foods through institutional food service and a lot of different kinds of venues. And we also work not only in schools, and I have colleagues here from the school health branch, but also in early care and education. And that is a really critical venue in talking about access to food and learning about food. And some of these things that Alastair was talking about, the farm to school approaches, can be translated to early care and education as well. Getting those kids into those healthy taste preferences, understanding where food comes from, what a farmer looks like and what do they do. All of those are critical ways to really try and promote good, healthy eating from the various early stages of life.
Thank you. So Will, she talked about strategy. So how you all at Wholesome Way, you've been on my show, right? Correct?
I have.
I probably asked you this before, so it's a great show, right?
The bright lights are blinding me, so I don't know. Maybe I'm on the show now.
In terms of strategy, how are you all working to play your part in all of this?
Well, Rose, thank you for the question, and we're honored to be here. We at Wholesome Wave Georgia work around the state of Georgia. We work through our partners at the USDA to double the program that we used to call food stamps, that we now call supplemental nutrition assistance programs. We work with a number of partners, a lot of which are in the room. One is Small Bites Adventure Club, which teaches children to love, like, and eat vegetables. We work with our friends at community farmers markets who operate mobile markets at MARTA stations here in Atlanta that provide that access that Stephen talked about. And then we also work with our partners at Open Hand to provide some amazing cooking classes as well, because one needs to know how to cook food. Not many of us cook now. And then also, we also work with our partners at Rataza to bring food to communities in need. Here in the state of Georgia, Rose, 1 out of 9 children are food insecure. And what that means is that children in the state of Georgia, 1 out of 9 of them do not know where their next meal is coming from. So to Stephen's point earlier, we at Wholesome Wave Georgia sit at the intersection of access and affordability. We, through our partners at USDA, double those food stamps so that Will and his family can go to any one of our 73 participating farmers markets, farm stands, mobile markets, and brick and mortar retailers, Stephen, to double the value of those food stamps. Schools are really important to us because we know through schools, if children say, I want to go to my farmer's market like Grant Park, mom will take them, dad will take them, grandfather will take them, auntie will take them. So we at Wholesome Wave Georgia work through our community partners to make sure that those locations, Rose, are open, accessible, staffed with people with smiling faces and good attitudes so that we help increase
Thank you for that.
access.
Lysa, we know that when it comes to the work that you all do, there's that intersection between healthy eating and healthy playing. And as someone who's both as a kid, knowing that importance, but folks need to understand not every student has access to that. And I want you, for our audience, to make this connection when we talk about healthy eating and how it correlates with healthy play.
Beautiful setup, because that's what's been on my mind all morning. And in all the sessions that we've had around how the White House has challenged us to come together and really address a big problem by 2030. And for us at KABOOM, we're an unlikely suspect. If you look at us on the surface, we're focused on building play spaces, engaging communities and kids to design and build their play spaces. And we've hit in Pillar 4, which is all about physical activity. And when we think about what we're trying to do at the end of the day, which is make sure that our kids are not hungry, that they're healthy, that their families are the same, that we are addressing preventable diseases, that we are addressing the disparities that affect everything, everything in communities of color. When you talk about play spaces and the work that we do, what we've grown into is really looking at wellness infrastructure. And so the first commitment that we made as part of the White House challenge was with our partners in Oakland, at the Oakland Unified School District, and with the Eat, Learn, Play Foundation, which is Steph and Aisha Curry's foundation, which is really looking at the intersection of food and literacy and physical activity. And what we have grown into is creating an oasis, like a wellness outdoor oasis for kids and families and adults to be able to have that physical activity that is necessary for healthy bodies and healthy minds. And so when you imagine outdoor space and when you imagine the work that we're doing around food insecurity and wellness and health, think about that outdoor space as the environment that encourages us to make healthy decisions. And that really connects directly to community members who are looking up and looking around them and looking for daily prompts to make the healthy choice. And so our spaces, what they're looking like now, are outdoor nature exploration areas. So imagine a schoolyard and a school system where only 19% of the boys and 9% of the girls are getting the 60 minutes that the CDC recommends of daily play activity. But imagine that outdoor space now having nature exploration areas, a sport court, a food garden, adventure course, 2 play spaces, murals all over the wall. And I'm trying to describe this in a way that we can see how important it is for our kids and their families to look around them in their communities and not see concrete, but to see things that invite them to be physically well. And so for us, it is really important when we're having this conversation to not just think about what we're putting in our bodies, but what our wellness infrastructure looks like in terms of making sure that community members have everything that they need, all the resources and tools, and that it's right in front of them so that the healthy choice is the immediate choice.
Thank you. Kelliann, Will talked about that 1 out of 9 here in Georgia kids are food insecure. And we're having this conversation in Atlanta, but I think my question for you is there a perception when we talk about food insecure, people sort of forget about the rural community? And that they figure, oh, no, they can't be out there because they have access to all of this healthy food. But that's a misconception.
Yeah, thanks for that question, Rose. I think, when we look across the country, zip code should not determine whether you go hungry or not, right? And I think when we look across the country and think about hunger and food insecurity and diet-related diseases, we really need to be thinking about root causes, and we know that families who are not economically stable or economically secure are forced to make really impossible decisions, right, about whether to pay their medical bills, whether to pay for rent, whether to pay for food for their kids. And no one should have to pick between those things, right? No one should be forced to make those impossible decisions. We know what works. We've been talking about the school meals programs. We've been talking about SNAP and other really critical nutrition assistance programs. But we know what really works is to put cash in people's pockets. And so when we had the expanded child tax credit in 2021 through the President's American Rescue Plan, we saw that food insecurity dropped 26%. 26%. And now we don't have the child tax credit. The expanded child tax credit, and so we've seen food insecurity start to rise again since 2021, unfortunately. And that's why President Biden keeps calling on Congress to expand the child tax credit. We know it works. We know it works to address food insecurity. And so I just wanted to mention that absolutely critical to keep the federal nutrition assistance programs, maintain them, expand them, but we also need to make sure that we're addressing root causes.
I actually want to read a quote from Georgia Governor Brian Kemp's office, and he was asked about why they weren't participating in that summer food service, and this is a quote from the governor's office. Don't tweet and say I said this. This is what he said. Okay. Quote, federal COVID-era EBT programs not only lacks basic nutritional requirements and sustainability, but fails to address the mission of improving the health and wellness of our Georgians. Now that was as it relates to this summer food service program. Georgia is going to continue with its own program, not getting too political, but how concerning is that to you to hear a statement like that? Will?
I want to jump in on that because we at Wholesome Wave Georgia work through the SNAP program, which Kelliann mentioned, to provide access in rural and urban Georgia, all across the state. One of the things that we see, and I think some of you all in the room will identify with the statement, states are the laboratories of innovation. The president deserves a great deal of credit, and also the secretary deserves a great deal of credit, the Secretary of Agriculture, because one of the things that's not obvious in this school lunch, school breakfast, child discussion is our overall economic health as a country. We are almost a $30 trillion a year economy here in the United States. The state of Georgia alone has a GDP equal to that of the country of Poland. One of the things that gets missed in this conversation, and the Secretary of Agriculture deserves a lot of credit for this, is linking rural hunger, rural inaccess to opportunity, rural lack of broadband, rural lack of access to school breakfast, school lunch, to our national security interests. Many of those serving in the United States military come from rural communities. And if those communities, Rose, to your point, dry up and die, we are at a significant national security threat. So rural hunger, urban hunger, when you look at the numbers, the CDC Foundation has done some great work on this. They're all the same. Lack of transportation is the #1 issue why people do not have access to fresh, healthy, local-grown food. Lack of income, to Kelliann's point. We cannot afford it. Food has to be affordable. So we at Wholesome Wave Georgia sit at the intersection of affordability, access, and also working with community partners all across the state to keep our prosperity strong as a country.
Yes.
So since we mentioned rural efforts, I just wanted to put a plug in for some of our CDC programs that do work in rural communities. So we have 3 different funding programs out of our division that work at the state and the county and the more community level. One of those is the high obesity program. The state one is SPAN, and the other is the racial and ethnic approaches to community health. Georgia is lucky to actually be a recipient of 6 sites are recipients of those funding. And so we have opportunities to work at the state level and then some state coordination through the University of Georgia and through those communities that are funded through our racial and ethnic approaches to health to really coordinate programs around food access, availability to physical activity, and so forth.
As we begin to wrap up, and I've been hearing this a lot, and you all hear this lack of access, but it makes me wonder, is it really lack of access or failure to deliver from the people who should be doing it?
I think it's a bit of both, Rose.
That's just me.
I think it's a bit of both, and we've been doing this work for 15 years. Last year alone, we had about 28,000 SNAP transactions of people swiping those EBT cards all around our state. And what we're seeing, and the USDA has been leaders on this, this is another point, and this is why I think this summit is so important. All of us are involved in creating the America all of us want to live in. But what we see is that if you don't have access, meaning that if you can't get to where the good food is, You're going to have diabetes. You're going to have high blood pressure. You're not going to live as long. You won't be able to come to Emory University and get a good job. You won't be able to buy that home. You won't be able to drive that Tesla, right, that doesn't run on gasoline. All of these things are connected. And when we look at our most vulnerable, underserved communities, rural and urban, Rose, to your point, they are being left behind rapidly.
So go ahead.
Yeah, I just want to jump on that because I agree that it's a little bit of both. And one thing I want to caution us as we're trying to problem solve is it's at the center of what we're trying to fix is fusing relationships as well. So lack of a failure to deliver implies that we're going to drop a solution down on somebody. And what we really need to make sure that we're mindful of is that I don't have the right answers for what you do with your life. But if I ensure that what's true for one is true for all, and you have availability and you have access to what you need, then we're on the right path. But I want us to be careful about thinking about things around failure to deliver, because in no way should we ever try to drop solutions onto a human being that has lived experiences that we don't know. And so how do we move into a space where we're having dialogue, where we're supporting behavior change so that people can make healthy choices?
Alastair?
Yeah. Thank you for saying that. I was thinking something very similarly as you were speaking. I think Atlanta Neighborhood Charter School is the perfect example of a program, a farm and nutrition program that works for the students we serve. It works for our community. It has been working. And if anything, I think it's proof that this can work in any context. But in that, we still need to be careful to make sure that we are not coming in as the ones with the one and only answer. And as we are thinking about, as a neighborhood school, what it means to perhaps replicate similar programs or partner with others, we as a school are very, very mindful of that as well.
How much community input from those in your neighborhood do you all rely on and you invite them in to be, people say, a seat at the table? How much of that is actually happening?
To be perfectly honest, it's not happening as much as it needs to. Right now, our food and nutrition programs are serving the students who are at our school, they're serving our staff. We know that if we are to live into our mission as a neighborhood school, that we need to embrace the entire neighborhood. We need to figure out how to do a better job of also involving the neighborhood that is Atlanta. When we talk about inequity in Atlanta, it is vast. It is vast. And we need to be able to acknowledge that and figure out how to build bridges in a way that doesn't say that charter school with the resources in Grant Park has the solution that's going to work for everyone. We're an example of what this can look like, but our success is contingent on the success of Atlanta as a whole, not as a neighborhood that's relegated to a few blocks around our school.
Diane, you want to add
Yeah,
something?
and I just wanted to add for our funding programs, they're 5-year cooperative agreements. So we're working with those states and communities for 5 years, hand in hand, meeting with them regularly. We have a national training coming up in May where we're bringing them all in, all 83 of these teams, and really coalition building and assessment and really working with those states and communities in their context and their needs is core to the work that we do from CDC.
Kelliann, I'm going to give you the last word because based on what Lysa said and then Alastair here, in terms of being able to have this holistic approach and have community partners, people on the ground, people who are in the communities, are you all hoping that this strategic plan then does ensure that these communities are a part of the solutions what Lysa talked about and will?
Yeah, absolutely, and appreciate Lisa's partnership with the KABOOM and making commitments through the White House Challenge. I think, we have built such incredible momentum that we're really excited about and energized by from the White House Conference that we held in 2022. And so we have been holding monthly calls with stakeholders since then. And if you're not on the monthly call list, please come find me or Will afterwards. We'd love to sign you up for it. But that's our way of kind of keeping the momentum and showcasing partners like CDC who are making incredible progress on implementing the national strategy. We have a rotating cast of characters from federal agencies as well as external partners like KABOOM, who's made a commitment, come on and talk about the progress that they've made. And we've seen already folks who have come on say, hey, I didn't realize they were doing this. Maybe we could partner. And so we're starting to build collaborations that are brand new, that are really exciting as well. So please hold us accountable. We put out the national strategy because we aim to implement it and we are making progress, but we learn from you. And so please come up, introduce yourself. Would love to learn more about what you're doing.
All right, Kelliann, Alastair, Will, Diane, Lysa, thank you all so much for being part of this conversation. Good information.
Thank you.
And that is it for this panel. I believe I want to be back in a moment with another panel, so hang with us.